Why don't we have real price transparency for medical services? Imagine going to a restaurant and seeing the exact price of every dish before you order. Now, think about why that doesn't happen in healthcare. Why is it so hard to know what a medical procedure will really cost before you get it? The truth is, several factors make clear prices nearly impossible to find in the current system. First, government regulations play a big role. Hospitals and clinics need special licenses to operate, and these rules often limit who can provide certain services. This creates fewer options for patients and keeps prices high because providers don't face much competition. When fewer providers are competing, they don't have to tell you their prices upfront. Second, large healthcare companies and insurance firms have a lot of influence. They work closely with the government and often shape policies to protect their profits. These industries prefer complex billing systems that hide true costs. If prices were transparent, it might expose how much they inflate costs or how their billing practices are designed to maximize revenue. Third, billing in healthcare is incredibly complicated. A single procedure might involve multiple bills from hospitals, doctors, labs, and pharmacies. Each one negotiates different rates with insurance companies. Patients usually pay only a part of the bill, called a co-payment or co-insurance, which is often based on negotiated rates rather than the actual list price. This makes it hard for anyone to see the real cost upfront. Fourth, most people pay through insurance, not directly. Insurance companies negotiate prices behind the scenes, so patients don't see the full cost of services. When you don't see the actual price, you have less motivation to shop around or ask questions about costs. This disconnect keeps prices hidden and prices tend to stay high. Fifth, although some federal rules requiring hospitals to post prices for common procedures, these rules are often weak or poorly enforced. Many hospitals delay or avoid posting prices altogether. Industry groups push back against transparency efforts because revealing prices could threaten their profits or expose inefficiencies. From a libertarian point of view, these issues are mainly caused by too much government control and regulation. Libertarians believe that removing licensing barriers, deregulating insurance, and allowing direct payments between patients and providers would create more competition. When providers compete openly on price and quality, prices would become clearer naturally. Patients would then be able to compare costs and negotiate better deals. Practically, this means removing government restrictions on healthcare providers, ending monopolies on licensing, and encouraging insurance markets that are more transparent. It also involves promoting direct payment models where patients pay providers directly, making prices visible from the start. In the end, the lack of real price transparency in healthcare is a mix of regulatory barriers, industry influence, and billing complexity. Libertarians see these as signs of government overreach and believe that a freer market would lead to clearer prices, lower costs, and more choices for everyone.